When I was pregnant with my son, all I could think about was getting to hold him and look into his little eyes for the first time. The reality of it was watching him get wheeled out of the delivery room in an incubator because he was born prematurely. It is hard sitting alone in your recovery room thinking about your baby at another facility and hoping that he is getting the care he needs. Many of you probably trying to imagine how you would feel in this situation. Premature birth is the leading cause of death among newborn babies. Today, I will tell you about premature birth, its risk factors, and preventative measures. First, premature birth is any birth prior to 37 weeks gestation. According to the Center for Disease Control, more than 500,000 babies in the United States are born prematurely each year. That is 1 in every 8 babies. The Quint Boenker Preemie Survival Foundation states that survival rates are 17% for 23 weeks gestation, 39% at 24 weeks, 50% at 25 weeks. They also go on to say that most babies are able to survive with the use of medical technologies at 32 weeks gestation. Those preemies that do survive may require special care and can spend weeks or even months in the neonatal intensive care unit. These tiny survivors are also susceptible to lifelong health problems, such as intellectual disabilities, cerebral palsy, breathing or respiratory problems, vision or hearing loss, and digestive problems. Next, any woman can give birth prematurely. However, some women are at greater risk. Those women include those who have had a previous premature birth, those pregnant with multiple babies, and those with certain uterine or cervical abnormalities. There are also lifestyle factors that increase the risk, such as late or no prenatal care, smoking, drinking alcohol, illegal drug use, domestic violence, lack of social support, as well as high stress levels. Aside from all that, there are still other factors to take into consideration. Certain medical conditions can also increase the risk, those being certain infections, high blood pressure, diabetes, clotting disorders, being under or overweight, having a short time period between pregnancies, pregnant by in vitro fertilization, or birth defects in the baby. Finally, there are ways to reduce the risk of premature birth. A woman should have a thorough checkup prior to pregnancy and work with their doctors to address any medical conditions that could put them at risk. Also address any lifestyle changes that need to be made, such as to quit smoking, avoid alcohol, and illegal drugs. After becoming pregnant, a woman should seek prenatal care early and regularly and be open with their doctor about all issues and concerns that may arise. The March of Dimes highly recommends women take a multivitamin containing folic acid before and during pregnancy and state that it can also reduce the risk of certain birth defects of the brain and spinal cord. Today, I told you about premature birth, its risk factors, and preventative measures. Premature birth is the leading cause of death among newborn babies. As a parent, wouldn't you want to know that you did all that you could to lower the possibility of premature birth?